Greetings, fellow humans. Katrina here. Quick disclaimer, I'm a professional, not your professional. Nothing I'm about to say should be taken as medical, legal, or otherwise advice. This podcast is purely for education and amusement. That is it. Disclaimer over. So today I thought I'd talk about what I don't know about the Health Information Exchange. Some of you know that Oklahoma has recently adopted the Health Information Exchange system, and so there's a few things in history that might be helpful to know about the national push towards the HIEs. That's how I'll refer to the Health Information Exchange for most of this time as the HIE. So in 2004 was HIPAA, and that was the Exchange for Data Treatment, Payment, and Operations. And in 2010, there was meaningful use, and that requires interoperability, basically speaking, communicating together between Medicare and Medicaid providers. And then in 2020, the 21st Century Cures Act, that identified that hospitals must notify the provider of all patient admissions, discharges, and transfers. And then in 2022 was also the 21st Century Cures Act developed penalties for data blocking, and requested information must be shared. So here are a little bit more recent events with the HIE developments, and more specific to Oklahoma. In May of 2021, SB 751 created the Oklahoma State Information Network Exchange, or Oklahoma Shine, OK Shine. The rules were created and passed legislature and governor. Then in May of 2022, we had SB 1369. This created the Office of the State Coordinator for the Health Information Exchange. It designated that the HIE organization be named the state designated entity for the HIE operations, and that is going to be, or actually is, My Health Access Network. They're the main ones who run basically the electronic health record. Now, SB 1369 also declared a mandate that, quote, all licensed providers participate in the statewide HIE by July 1st of 2023. You'll notice we're past that date and that hasn't been implemented. We'll get to that in a little bit. But also the coordinator may promulgate the rules via the board approval that include exemptions. Then in September of 2022, the emergency rules passed by the board and governor. Again, in March of 2023, final rule adjusted based on comments to increase exemption eligibility. That was passed by the board. June of 2023, defaulted to governor for approval. He disapproved with suggested revisions. That's why the HIE rules didn't go into place July 1st of 2023, is because of the governor. Governor Stitt disapproved with suggested revisions. And in July of 2023, new rules were proposed and posted for public comment, and exemptions available upon request. So then we move to June of 2023, where we have SB 32X. And what that is a legislative appropriation of $30 million specific for HIE connection funding through grant application. Grant administration and requested process in development focus on minimal provider action. Looking at opportunities to match state funds with federal funds, the town hall that I went to, though, said that the chances of that happening are very unlikely, having the state funds matched with federal funds, because there was apparently a window for which to do that, and Oklahoma missed that window. So the new emergency rule that I want to go over, this is just part one. This is the highlighted sections that have been changed in the Oklahoma statewide HIE. Under purpose, it now says, the Office of the State Coordinator for HIE is the office within the Oklahoma Healthcare Authority, that's OCA, that holds the power and duty to oversee the state-designated entity, SDE, for HIE, including the oversight of HIE operations and the process in which the SDE establishes fees. So now they went on to define a couple things, and specifically healthcare provider means any public or private organization, corporation, authority, partnership, sole proprietorship, association, agency, network, joint venture, or other entity that is established and licensed, certified, or otherwise authorized by the laws of this state to administer healthcare in the ordinary course of business or private of a profession, and or employs licensed healthcare workers in the state of Oklahoma. Healthcare provider includes, but is not limited to, facilities such as ambulatory surgery centers, clinics, home care agencies, hospices, hospitals, intermediate care facilities, laboratories, long-term care agencies, medical centers, mental health and substance abuse disorder treatment centers, nursing homes, PACE centers, pharmacies, physician's office, psychiatric hospitals, public health clinics, and rehabilitation centers. Whew, that is a lot. And so the new emergency rule part 2, the second definition is the health information exchange. It says it means the electronic movement of health information between organizations according to nationally recognized standards for purposes including but not limited to patient treatment and administration. And then I'm going to skip what the Health Information Exchange Organization definition is because that hasn't changed from the old rules to the new rules, but they did define OK-SHINE, means the Oklahoma statewide Health Information Network and Exchange, a collective effort of the Office of the State Coordinator and SDE in support of the statewide Health Information Exchange. And then they went on to redefine Report Data 2. And so the Report Data 2 means that the healthcare provider shall establish a direct secure connection by state-designated entity for HIE, remember I mentioned that was my health, and submit data according to the United States Core Date for Interoperability standard. The form and format are further defined in the specifications on the OK-SHINE website. Providers shall transmit data types they collect within their electronic health record, with the exception of any data that, 1, the provider determines to be sensitive patient information that is to be suppressed from transmission, is subject to a patient's request for exclusion, consistent with provider-implemented policy, or 3, such transmission would violate state or federal law or regulation. This is where my profession comes into play. The mental health records for a clinician that's a master's level counselor or any mental health provider, that includes nurse practitioners, other mental health services, that is protected at a higher level by the laws already in place in the state of Oklahoma. And so that sounds to me like an automatic exemption. And so it also says required participation, but providers may request an exemption from required participation as specified in paragraph F in the form, which if we scroll to paragraph F, it says exemptions. Any healthcare provider that is defined in paragraph C of this section may register an exemption from reporting data to the SDE and or utilizing the HIE on the OK-SHINE website by registering an exemption with the Office of the State Coordination for HIE. It goes on to describe a few other exemptions, but going back to paragraph D of this section, so that was the required participation that I talked about, shall not apply to a healthcare provider does not currently own or subscribe to electronic health records, technological system, or service. B, healthcare providers classified as substance abuse treatment facilities covered by 42 Code of Federal Regulations, CFR Part 2. And 3, patient-specific prohibited health information requiring patient consent prior to disclosure shall only be disclosed in compliance with relevant state or federal privacy laws, rules, and regulations or policies, including, but not limited to, the Health Information Portability and Accountability Act of 1996, that's HIPAA, and any laws that require patient consent prior to sharing health information. So we're skipping ahead to the fees and the subscription fees. They originally had like a $5,000 sign-on thing that you had to, that was like a one-time connection fee. I think that they're working on getting grant funds. I think that is in here under fees. Number 3, grant funds. Healthcare providers may apply for a grant cover connection fees subject to the availability of funds. Grant fees for connection will be paid directly to the SDE on behalf of the provider. Information on grant eligibility can be found on the OK-SHINE website. And so, as I mentioned with the exemptions, I read off the first one already as far as any healthcare provider defined in paragraph C of this section may register an exemption. But then it also says 2 exemptions. All providers that register an exemption shall be granted such an exemption and shall not be subject to pay subscription fees and or connection fees. Number 3, the exemption will automatically renew annually unless the provider withdraws their exemptions and elects to participate. So then there went on to be a question and answer section of the town hall. That's the information that I'm reiterating is what I received from the town hall like last week or the week before. I'm not sure when it was, but there was a great question posed in the chat area during that Zoom town hall. And that question was, are there any disciplinary actions in place for not participating in the HIE? It currently doesn't look like there are any. And a response from one of the moderators, Chad Sigler, was there are no disciplinary actions for non-participation. So as it stands, my practice will continue with non-participation at this time. In the event that I have the option to opt in at a future date, then I would apply for that through the Oklahoma Healthcare Authority system that they already have in place. At this time, it doesn't even sound like I need to file for an exemption. I exist and am covered under the laws that exist already on the books, and so I'm not worried about it. If anybody has any questions about the Health Information Exchange, they have a lot more information on the OK Shine website, on the Oklahoma Healthcare Authority website, and then there's always the Oklahoma Board of Behavioral Health, which usually will direct you to Oklahoma Healthcare Authority for further questions. But those are some of the resources that are out there and available to get more information. And so if anyone's worried about the Health Information Exchange, talk with your providers, ask them what it means for you. A lot of times our information cannot be shared without written consent. And so being it's an opt-out program, then you might have an opt-in form that is automatically put in front of you in front of a doctor. And you might read that form carefully and decide whether or not you want to opt into this health information exchange. If they say you cannot receive services by opting out of the health information exchange, you might dig a little deeper and see if that's accurate, because I don't know if that's something that can be done or not. So this health information exchange that was supposed to go into effect in July 1st of 2023 seems to be on hold until the new rules get approved through the legislation and through the governor's office. Now, let's say that all goes through. It doesn't look like a whole lot has to change for my practice personally. I might just have a few verbiage in the consent forms switched up, but it doesn't mean that you would be consenting to participate in the health information exchange. My understanding is that my practice has the ability to opt out of that by doing nothing. And so that's what I'm going to do. I hope you enjoyed today's informational and educational and potentially amusing episode. If you want to support the show, click the button on the website. And remember, I appreciate each and every one of you simply for existing.